All right, team, welcome back. We're going to be doing a quick video review on ventricular trigeminy. And so as trigeminy, as the name suggests, this is a premature beat every third beat. So let's take a look at these beats. Let's look down. I will say, I think the best lead to look at would be maybe V1. And so V1, let's kind of scan through. We've got normal QRS, funky, normal, funky, normal, funky, normal, funky. Okay, and let's look at our normal beats. We'll zoom in on this one. So we've got our P wave causing a narrow QRS. We've got our T wave. We see it occurs again here. And then we've got this wide QRS. So this is wide. If you notice, if I draw an interval from here, where this normal beat is, to the next normal beat, I would expect the next QRS to land there. But see, this is early, so this is a premature beat. And all these beats we see are premature in the same fashion. And so when we know premature beats, we can think, is it a PVC? Is it a PJC? Is it a PAC? Which is it? And that's important because we want to know what part of the heart is producing these premature beats, because then we can know how to stop it if we need to. And so what you can do is, one, you can determine this is a wide complex QRS, so it's likely a premature ventricular contraction. It's kind of giving us evidence towards it, but that's not the only thing we can utilize to say this is a PVC. Let's look in front of it and see, are there P waves? And I would say no, I don't see any P waves. Let's look here before this one. No P waves. Before this one, no P waves. We can use other leads, and you would say, okay, well, here's the PVC. Is this a P wave? Actually, that's just the T wave from the previous QRS, and you can compare that to this T wave, very similar. Always remember, with T waves, you can always compare. And so if you kind of scan throughout, you see there's no atrial activity that is occurring before these PVCs. So that's how you know that these are premature ventricular contractions. So yes, this is a premature ventricular contraction, not a junctional, not an atrial. And because of that, and because of the fact that they're occurring every third beat, we have normal, different, normal, different, 1, 2, 3. It's occurring in this trigeminal pattern, and the cause of the trigeminy are premature ventricular contractions. So this is a ventricular trigeminy. And so this terminology is important to use. Somebody asks you what the rhythm is, you can say this person's got ventricular trigeminy. And so based on the clinical scenario, you go from there. So hope that's helpful. Have a great day.